Welcome once again to the Active Health Podcast, where we're going to discuss all things health, fitness, and performance, and we believe in taking an active role in your health. I'm Dr. Josh Mason, and today I want to discuss what I believe is a really important topic when it comes to approaching treating patients and treating health in general, and that's getting to the root cause of the problem. This is something that we see as a common philosophy difference between what we do and the typical medical paradigm. And I don't want to take this podcast and talk negatively on anything in particular. It's just about getting to the root cause of your condition, whether it's pain, a chronic condition like blood pressure or cholesterol or kidney function, or even a symptom simple as a headache. But getting to the root cause of the problem is going to be the most efficient way and the best way for your body. So let's just look at a couple of those examples and just talk through them and start to see the differences in the mindset shift that it takes to treat efficiently and get to the root cause of the problem without doing too much harm. So let's take some chronic conditions, like say high blood pressure. A lot of people do suffer with high blood pressure. It's a very common thing. We have lots of patients that come in that are on high blood pressure medications. But I think we can all agree, or maybe we aren't even aware of this, but the medications they put you on isn't treating the cause of high blood pressure, right? So the medication they're giving you is treating the symptom. It's going to cause vasodilation of the blood vessels or some other mechanism, but it's not treating the actual cause of what's causing your high blood pressure to begin with. Same thing with cholesterol. The medications they give you, it's not changing the mechanism that is initially causing high cholesterol. It's actually turning off processes or doing something negatively. And when we're not treating the actual cause of the problem, there's going to be symptoms in the long run. But if we can actually get to treating the actual cause of the condition, then the actual result will be longer. Let's go ahead and just translate this all the way to what we do in our office very commonly. A couple of conditions. Say, let's headaches. I use this oftentimes. People actually, and patients, they think that having headaches are normal. And I'll tell you right now, having headaches is not a normal occurrence. But when they have a headache, a lot of times many of you will reach for, some aspirin or ibuprofen. And if we say this out loud logically, I think we can all agree that the cause of your headache today is not due to a deficiency of an aspirin or an ibuprofen. I know when I say that out loud, it kind of just sounds like I'm being a smart butt, but let's think about it. You really aren't deficient in ibuprofen or aspirin. And so even though in the short term, it is potentially making your headache go away. And when we're in those desperate times and we can't sleep or it's really affecting our day, potentially we can see some benefit to taking those things for that. But we're not getting to the root cause of the problem. And in some cases, we're doing harm. Let's look at back pain. I can guarantee you do not have back pain today because of a deficiency, once again, in ibuprofen, right? The cause of your back pain is not because your body lacks ibuprofen. Once again, when you take ibuprofen occasionally, and in some cases, it will decrease your pain because it's changing a mechanism, but it's treating the symptom, not the cause. So the cause, what is causing the back pain? What is causing the headache? Not treating the inflammation of what's going on. Yes, that's important at times. But I'll tell you one thing uniquely, we will have symptoms or side effects of those medications downstream if we're not getting to the root cause. Look at ibuprofen, for example. People don't even understand this, but when we have pain, we have an injury, there's an inflammatory cycle that's going to take place. And if we don't want that inflammatory cycle to be out of control, but it needs to happen for healing to take place. So when you have a typical ache or pain and you take ibuprofen over and over and over again, and you're stopping that healing process, stopping the inflammatory process, essentially you're telling your body, I don't want to heal. And when I say that out loud, a lot of you are like, what are you talking about? You mean I shouldn't be taking ibuprofen when I have pain? And no, you're not getting to the cause. You're just treating the symptom. You're treating the pain. You're not getting to what is actually causing the pain to begin with. And that's what we take pride in here at Active Health Clinics, is we want to go through the process of figuring out why you're having the headaches, why you're having the back pain, why is your knee hurting, why is your shoulder hurting? And it's not, yes, there's an inflammatory cycle going on, but that's not the cause of the pain. Yes, that is causing the pain, but what caused it to be inflamed to begin with? We want to treat the tissue, treat the condition, treat the biomechanics to figure out what we need to do to actually eliminate the cause. So then the cycle of inflammation doesn't happen, and thus the pain doesn't happen. And so that's the process we take you through. As far as when a patient comes in, we are taking a full history. we're taking a history not only on the pain they're having, but their full health history. And we actually will have patients kind of get frustrated with us that we're asking them questions that seem unrelated to their current condition, but also, and ultimately, we want the full story. We want to get to the root cause. It could be something that you're not even thinking of. It could be a process, something the way you're moving, potentially another medication you're taking, or the foods you're eating that are contributing to your current condition you're coming to us for. So we want to go through a full history and figure out exactly what's going on so we can get the whole story. Once we have that story, the history, we're going to move on to an examination. So what an examination does for us, whether it's putting you through ranges of motion or some orthopedic testing or potentially some imaging, those are just, again, building the whole story for us so we can see what is going on down to the root cause, so we can treat the appropriate tissue and get to the root cause. So the pain or your condition or your complaint, we can resolve relatively quickly with less side effects and hopefully a long-lasting condition. Okay, so then after we've done the initial exam and potentially some imaging, and then we're able to get that whole story and we can make an official, solid diagnosis that we can attack with an appropriate treatment plan. And we're going to choose things in the treatment plan that is treating the cause. Also, at some point, we are treating the symptoms. So, for example, someone comes in with a headache. Most oftentimes, when people are having reoccurring headaches, we find quite frequently that they'll have a subluxation or a misalignment in the neck. And that is causing, muscle tightness because of the response. It also can irritate the nerves, all of which can cause those headaches. And yes, they're in a lot of pain right now. So we'll help them manage the pain today, potentially with some passive therapies, like an ultrasound or an e-stim or a laser. We do want to help them manage that inflammatory cycle while we're actually treating the cause with the adjustment and giving them the appropriate frequency to make that lasting change. And so we go through that process and we're managing the current symptoms with things that are not going to have side effects at the same time as we're treating the cause. So we're treating that misalignment, but then also we may follow up with some exercises. Maybe we need to work on their posture. Maybe we need to work on their workstation or strengthen certain tissues in their neck so that this doesn't continue to reoccur. But ultimately, we're getting to the root cause and not just taking some ibuprofen and having the inflammation go down, but we didn't actually treat the initial cause. And so that is the big difference and the big philosophy change and the big mindset change it takes to actually treat root cause. And so that is where we accelerate, hopefully, for patients and how we're different. Constantly, I have patients that will come in and they're just sick and tired of having the same condition over and over and over again. And it's because for years and years and years, they've just treated the symptom and not the root cause. This is very common. It doesn't matter what condition it is. It could be these chronic conditions of pain. It could be chronic conditions of metabolic disease. It could be chronic conditions in any way. But ultimately, we got to get to the root cause. And again, I want to end and kind of wrap up with that. I'm not downplaying in the allopathic method, because when we have acute ER care, we need surgery. Those things are awesome. We need them in place. But for a lot of our conditions, if we just get to the root cause and take a step back, and I think the question we have to ask several times as we're trying to figure out what the root cause is why? Okay, so my back hurts. Why? Well, right now it's spasming. Why? It has some swelling in an area. Why? I can't move my leg in this way. Why? I can't stand up without my back hurting. Why? So when we ask why and we go why, we go down this process of getting us closer and closer and closer to that root cause. And so that's what we're trying to do through the history, through the examination, and ultimately through treatments. That is at the same time, we're managing the current potential symptoms, but also getting to that root cause and hopefully the long-term benefit. So that's, again, why we at Active Health Clinics are going to get to the root cause of your problem and why we think this is the best way to treat patients. Once again, I hope you enjoyed this little blurb of information. We hope to continue to share topics with you. If you're continuing to like this information, go ahead and like, share, and subscribe to our channel, and we'll continue to give you information as much as we can. And if you have any interest that you'd like us to speak on, by all means, type in the comments, give us some feedback. I have a list of things that I think I'd like to talk about, but what would you like to hear? Ultimately, we want to give back and serve to all of you guys. So if there's something you'd like to hear, please let us know. Look forward to seeing you at the next episode.